Health Check is brought to you locally by Island Cancer Center.
The recent Hafa Day Pacific Medical Conference brought together physicians from the School of Medicine at Loma Linda University with the local wellness community. A theme was encouraging patients to adopt lifestyle changes and, in some cases, make the conscious choice to reverse their condition. Let's start with their philosophy on simple solutions.
There are some simple solutions that are not good solutions, all right? So I don't want to make it seem as if it's simple, then it has to be good, all right? The other issue is that even the medical communities around the world haven't embraced some of the simplicity of what we're talking about, because that's not what's taught in medical school, it's not what's taught in nursing school and the other health professional schools. So even though we're not breaking new ground, what we're doing is we're helping people to shift their paradigm, to be able to look at alternatives that are effective, evidence-based.
So, a lot of our focus this conference was talking about what we can do lifestyle-wise to help improve, because I understand not everybody wants to just get a medication or a treatment or things like that. So we focus more on lifestyle and looking at what's happening here on Guam. We look at the specific diseases that are higher here, such as diabetes, gastroesophageal reflux disease, obesity. All those things can be addressed with lifestyle recommendations. And so, it's difficult because there's two types of people. One that want to come in and just give me a medication and I don't want to have to put a lot of effort into it. Others would say, give me something that's more permanent, long-term, that I could work on my lifestyle. Because let's face it, lifestyle changes take effort, right, and commitment.
A big topic was the control of diabetes and how the pandemic affected people's health due to lockdown eating habits.
The amount of dialysis units have been increasing in the last years here in the island. And that is kind of very concerning, because it is kind of the manifestations of how are we taking care of ourselves in the overall. Kidney disease is preventable. As a matter of fact, during the COVID years, people actually ate better because they eat at home. They stop eating fast food. Fast food is the enemy. We have to be careful with that. Fast food has a lot of salt, a lot of preservatives, and the processed food is not good for our organism. It's better to eat at home. During the COVID years, we saw that the parameters that we measure in the overall health were better because people were cooking at home.
Further still, respiratory health was covered.
Respiratory illnesses are almost starting to have a twist, so to speak, on the way that, one, we're diagnosing, but two, what we're noticing is that our environment, the way we eat, what we're exposed to, are all contributing to what we would say is breathlessness. And the thing about being short of breath is that it's multifactorial. Sometimes we're short of breath not because of just the lungs, but it could be because of the heart, it could be because of another organ system. And you can imagine it's hard to tease that out. So we need specialists to help us out to be able to figure out what is exactly causing that shortness of breath.
And because we Guamanians really love our food, a big part of the forum dealt with gastrointestinal concerns as well.
Our one particular topic was GERD, or gastroesophageal reflux disease, or just heartburn. Another one that we focused on was on fatty liver. There are certain foods that can do it, and the ones that are highly associated are going to be carbonated drinks, fatty foods, tobacco, alcohol, caffeine, chocolate, even some tomato products and citrus. When they looked at spicy food, they did a study out of South America, and they measured acid levels after eating spicy food, and they saw it didn't change. But what the perception was that it actually caused more sensation of heartburn. And so, yes, you can eat your spicy food. It's going to give you the sensation of heartburn, but it's not necessarily destroying your acid, interestingly enough.
So let's wrap up with a visiting physician's thoughts on improving care. It's sound, honest advice that we can all apply today.
It's intuitive, but what I will admit is that it is hard to be able to try to go back to the way that we were created and the way that we were, because of just culture and just where we're at, and finance actually gets in the way too. But there are tips and things that can be done.
Now, it wouldn't be fair to say that you have diabetes because you want to have it. What I'm saying is that most people, even though they have things that predispose them to having diabetes, they don't have to make the choices that would make that diabetes appear to be as bad as it is. We say that the genetics and all of the things that go before, they may load the gun, but how we live is what pulls the trigger.
Being at home is good. It's actually good. Okay, go and eat out once in a while. It's not a problem. But sometimes people have the habit to eat outside all the time, and that's not good for anybody. We just have to enjoy our food, learn how to have good habits, and share with our family a good meal.
So I think they were very engaged, they were very interested, lots of questions on the topics that we were talking about, with excellent questions as well. So I think it was a very good interactive and hopefully educational experience for everybody.
Health Check is brought to you locally by Island Cancer Center.